Fibroids are one of the most common findings during a pelvic ultrasound, and many women who come for a scan are already worried. They ask questions like, can ultrasound really see fibroids? What causes them? Is there a treatment for it? Can it prevent pregnancy? Let us break it down in a simple way that is clear and medically accurate. Hi, my name is Chinaza. I'm a medical sonographer, and on this space, it is everything ultrasound. Today, we'll be talking about uterine fibroids. Firstly, can ultrasound detect fibroids? The answer is yes. Ultrasound is one of the best tests used to detect the presence of uterine fibroids. Fibroids are non-cancerous growths that develop from the muscle layer of the uterus, and because they are made from the muscle tissue, they are usually firmer and denser than the surrounding uterine tissue. And during an ultrasound scan, the machine sends high-frequency sound waves into the body. These sound waves bounces back differently depending on the type of tissue they meet. Since fibroids are denser than normal uterine tissues, they create a distinct mass that can be seen and measured on the scan. With ultrasound, we can determine where the fibroid is located, how many fibroid masses are present, how large they are, whether they are affecting the cavity of the uterus or not. All of these details help the doctors decide what the management need to be. When women come for a pelvic scan, fibroids are one of the most common concerns. Some of the most common worries include, is my fibroid cancer? First of all, fibroid masses are benign, meaning they are not cancerous. Ultrasound usually shows the features that are typical of benign fibroids. The next concern they have is, how big is the fibroid? Ultrasound allows us to measure the fibroids in centimeters so doctors can understand their exact size and monitor whether they are growing in subsequent scans. Another concern is, can fibroid affect my chances of getting pregnant? Not all fibroids affect fertility. However, ultrasound helps determine if the fibroid is located in a place that may interfere with implantation or pregnancy. Another concern is, will I need surgery? Not every fibroid requires surgery. The scan helps the doctor assess whether the fibroid simply needs monitoring or if treatments may be necessary. What do fibroids look like on ultrasound? Fibroids usually appear as solid, round, or oval masses within or attached to the uterus. Some of the common appearances include a well-defined lump inside the uterus, a different texture compared to the surrounding uterine tissue, dark or mixed patterns depending on the internal structure, posterior shadowing where the fibroid blocks some of the sound waves behind it. If the fibroid becomes very large, it may also distort the normal shape of the uterus, making the uterus appear enlarged or irregular. When a fibroid is detected during a scan, the ultrasound report usually describes several important features. Number one is the size. Fibroids are measured in 2 dimensions, the width and the height. This allows the sonographer to estimate the size of the fibroid and monitor whether it is increasing in size or decreasing in size over time. Large fibroids can sometimes make the uterus appear bulky or enlarged, which will also be mentioned in the reports. Number 2 is the location. The location of a fibroid is very important because it can influence the symptoms and fertility. Most times I get questions like this from patients. Is the fibroid inside or outside the womb? Fibroids are commonly classified based on where they grow. The uterus is divided into 3 layers: the perimetrium, which is the outer layer or covering, the myometrium, which is the middle layer, and the endometrium, which is the innermost layer where pregnancy or implantation occurs. Think of a mango, the peel, the flesh, and the seed. That's exactly how the uterus is layered. And then we have different locations of fibroids. We have the intramural fibroids, which is located within the muscle wall of the uterus. That is within the myometrium. We also have submucosal fibroids. These fibroids protrude into the uterine cavity. That's the endometrial cavity. They bulge towards the endometrium. We also have subserosal fibroids. These are fibroids that are within the myometrium, but they bulge outwards or outside. We also have pedunculated fibroids. They are outside the uterus, but they are attached to the uterus by a stalk. Think of it like a fruit hanging on a tree. What I'm calling the uterus is basically what is popularly known as the womb. Ultrasound helps us to determine the exact position of the fibroid within the uterus. Number 3 is the number. Some women have a single fibroid, while others may have multiple fibroids scattered throughout the uterus or outside the uterus. In some cases, the uterus may contain several fibroids of different sizes and locations, which can give the uterus a more irregular appearance on ultrasound. Changes can happen inside fibroid masses. Fibroids do not always remain exactly the same over time. As they grow, their blood supply may not always keep up with the size of the fibroid, and when this happens, structural changes can occur inside the fibroid, and these changes can affect how they appear on ultrasound. 3 common changes that appear on fibroid masses. Number 1 includes degeneration. Degeneration happens when parts of the fibroids begin to break down because of blood supply that is not enough to support the entire mass. And when degeneration occurs, the fibroid may develop areas that look irregular or mixed on the inside instead of the typical solid appearance. There are different types of degeneration, but on ultrasound they appear as cystic spaces, uneven internal texture, areas that look dense than the rest of the fibroids. Women experiencing fibroid degeneration may sometimes feel sudden pelvic pain, especially if the change happens quickly. Number 2 is calcification. Calcification occurs when calcium deposits build up inside older fibroids. They usually happen in fibroids that have been present for a very long time, particularly after menopause when the fibroid stops growing. On ultrasound, calcified fibroids may appear very bright or highly reflective, with strong acoustic shadowing behind them. This happens because calcium reflects ultrasound waves very strongly. Calcification is generally a sign that the fibroid is no longer actively growing. Number 3 is cystic changes. Remember we talked about cysts, and I mentioned that cysts are fluid-filled masses. Sometimes fluid-filled spaces can develop inside a fibroid mass. This is called a cystic change. It usually happens when part of the fibroid tissue softens or breaks down, leaving small pockets of fluid. On ultrasound, this may appear as dark fluid-filled areas within the fibroid, a mixed pattern combining solid and fluid components, and this type of change can make the fibroid look less uniform compared to a typical solid fibroid mass. I'm sure you're wondering what causes fibroids. I've gotten these questions from patients a whole lot. The exact cause of fibroid is not completely understood, but research shows that they are strongly influenced by female hormones, especially estrogen. Fibroids tend to develop during reproductive years. They grow when hormone levels are higher, and they shrink after menopause when estrogen level drops. So anyone with a womb is at the risk of developing a fibroid mass. There is no fixed cause for fibroid masses. Genetics may also play a role. Women with family members who have had fibroids are more likely to develop them. What are some of the risk factors of fibroids? Even though everyone with a uterus is at the risk of developing a fibroid mass, some factors are associated with a higher chance of developing fibroids. Number 1 is age. Fibroids are most common in women between age 30 and 50. Although I've seen a case where an 18-year-old presented with fibroid mass. It was a rare case, but it is also possible. Number 2 is family history. If your mother or your sister has fibroids, your risks may be higher. Number 3 is hormonal influence. Higher estrogen exposure over time may increase the chance of fibroid growth. Number 4 is ethnicity. Studies have shown that fibroids tend to occur more frequently and sometimes grow larger in Black women. Number 5 is early onset of menstruation. Starting menstrual cycles at a younger age may slightly increase the risks. What are some of the symptoms of fibroids? First of all, there could be no symptom at all, depending on the size, the location, and the number. So you may have a fibroid mass or fibroid masses, and you would not even have any symptom, and you will not even know about it until you come for a scan. And then for symptoms that are visible, it could cause moderate to severe pelvic pain. It could cause heavy menstrual flow. It could also cause prolonged menses. It could cause painful menstruation. You could feel pressure or heaviness in your abdomen. Sometimes you could also have visible swelling, bulging, or protrusion. And lastly, the location will determine if it can play a role in infertility. The locations of some fibroid masses can actually have a role in infertility issues. Treatment options for fibroids depend on several factors, including the size of the fibroid, the location, the symptoms it causes, and whether the woman wants to have children in the future. Some fibroids do not require immediate treatment and may simply be monitored with periodic ultrasound scans. Common management options include number 1, observation or monitoring. If the fibroid is small and not causing any symptoms, doctors may recommend watchful waiting with regular scans to monitor their growth if they are increasing in size. Number 2 is medication. Certain medications can help manage the symptoms such as heavy bleeding or pelvic pain. Some hormonal treatments may also help to reduce fibroid size temporarily. Please note, there is no drug that can shrink or remove fibroid masses. They are attached to the walls of the womb and they are continuously getting blood supply. And as long as they are getting blood supply, they would always be active. So most of the time I see women say, are there no drugs that can treat fibroid masses completely? There are no drugs that can treat fibroid masses completely. The drugs are simply to manage your symptoms, not to treat the fibroid mass. Most people sell herbal medications and all of that. Medically, those things do not have the ability to treat fibroid masses completely. The only permanent remedy we have is myomectomy. This is a surgical procedure where only the fibroid is removed while the uterus is preserved. It is often recommended for women who still want to become pregnant. And then we have hysterectomy. In more severe cases, especially when the fibroids are very large or numerous and causing severe symptoms, the removal of the uterus may be recommended. Fibroids are extremely common, and in many cases, women may not even know they have them until they undergo an ultrasound scan. An ultrasound scan helps the doctors to evaluate the size of the fibroid, their location, how many are present, whether there are internal changes such as degeneration, calcification, or cystic areas. This information helps guide the next step in management and determine whether the fibroid simply needs monitoring or further treatments like surgery. Like I said earlier, there is no drug remedy for fibroid. The only permanent remedy is surgery. If you have any more question or confusion, feel free to drop it in the comment section. Don't forget to like, share, and subscribe, and I'll see you in my next video.